from asthma to diabetic emergencies. Just some small changes to the adult hypoglycemia protocol. Um, Advanced EMT, or I'm sorry, EMTs, not much has changed for you guys. Just routine patient care. Make sure you get a glucose reading with your glucometer. If the patient can swallow and their blood sugar is less than 60, administer oral glucose. We don't carry glucagon here, so that's not something we're concerned about. But if you work at a service that does carry glucagon, you can give 1 milligram of glucagon IM and consider ALS intercept if needed. Advanced EMTs and paramedics, IV access and administer fluids to maintain a systolic greater than 90. If their glucose level is less than 60 with associated signs and symptoms, give dextrose 10 to 25 grams IV or IO and recheck the glucose 5 minutes after administration of dextrose. You can repeat the dextrose up to a total of 50 grams IV or IO if the glucose level remains less than 60. So we kind of got two options we can go with as far as which kind of dextrose you can give. We carry currently both D50 and D10 because we got a bunch of D10 and D50 is on back order. So if you're going to give D50, give it half an amp at a time, so 12.5 grams of dextrose, and reassess the mental status after 5 minutes, and then repeat as needed until their blood sugar is greater than 80. With D10, you're going to give 100 mLs wide open at a time, and reassess the mental status after each 100 mLs, and repeat the bolus up to 500, so 50 grams of dextrose. I highly recommend, if you have the option on your truck, like if your truck has both D10 and D50, highly recommend going with the D10. It's in the side pocket with the fluids in the red bag, and then if your truck still has the orange ALS bag, it's in the I can't remember if it's in the right side or the back pocket, but it's in one of those. Um, I highly recommend going with D10 over D50. The reason being is if you give so much D50, your patient gets almost hyperglycemic as opposed to hypoglycemic, and their body starts taking up glucose super fast, and then you have rebound hypoglycemia. So they become hypoglycemic again. You end up having to give them more dextrose. Another reason is D10 is a little more diluted. So if your IV infiltrates or something, it's a lot easier on the tissue as opposed to D50. So just take all that into consideration when you're deciding which one to give. I mean, if D50 is all you got, it's all you got, you know. So just keep that in mind. And again, if unable to get IV access, administer glucagon 1 milligram IM or sub-Q. We don't carry glucagon here, so really our only options if they're unresponsive is dextrose. So